As Americans end the holiday weekend, health experts say new coronavirus cases will spike again in the coming weeks. More than 13 million people in the U.S. have already tested positive for COVID-19 since the beginning of the pandemic. That's more than the entire population of Pennsylvania. So far, the virus has killed at least 266,000 Americans. The CDC warned before Thanksgiving that everyone should stay put. But tens of millions of people ignored the advice, and now they're returning to their homes and communities. CBS News' Mark Strassman reports.
COVID's community spread had a busy Thanksgiving. The virus had a chance to catch up with lots of family in jammed airports and in stores with Black Friday deep discounts. Red tags, red flags. At current rates, roughly 114 more Americans test positive every minute. 65 more Americans die from COVID every hour. And America could start to see 3,000 COVID deaths a day, more than died on September 11th. COVID has also blitzed the NFL from coast to coast. Tougher new restrictions in California's Santa Clara County leave the 49ers without a place to play or practice for the next 3 weeks. The Denver Broncos need to find a quarterback today. All 4 on their roster are now in quarantine, and 18 Baltimore Ravens tested positive this week. In the overwhelmed Midwest, the epidemic's showing signs of peaking. Not in South Dakota, where at least 30% of residents have been infected. 43% of people tested here this week tested positive. But for many, mask mandates remain even less popular than the virus.
This is cowboy country, man, and you try and tell someone to do something and they want to do the opposite.
Outrage in West Virginia. Masks now a must in all indoor public spaces.
I had many people that were calling and they were saying to me over and over and over, we want to be like South Dakota. We want to be South Dakota. Well, I don't want to be South Dakota.
I'm pleading.
Hypocrisy grabbed the Thanksgiving spotlight in Denver. Mayor Michael Hancock urged residents to stay home. An hour later, he was spotted boarding a flight with his family to Mississippi. But the way millions more Americans gave thanks this year, they should get them in return. They celebrated the holiday and each other by staying apart.
Captain Ron Golemboski joins me now from Bismarck, North Dakota. He is a U.S. Air Force registered nurse. Captain, the Pentagon is sending 60 U.S. Air Force medical staff to help deal with the surge in North Dakota. Are they already there, or if not, when will they be sent there?
Yes, sir. We are all already here. We arrived last weekend. We in process through the North Dakota State Department of Health. And then we went to 4 different locations between Fargo, Bismarck, Minot, and Grand Forks. And then we were taken in, actually welcomed with open arms by our brothers and sisters here in North Dakota in this fight against COVID. And they've welcomed us like family, treated us well over the holidays. And we're just proud to be here as part of this whole of America effort.
Well, Captain, what exactly will the personnel be doing there? Will they be directly treating COVID patients, or will they be support staff or other medical personnel?
No, we are hands-on on COVID units. So myself personally, I work at Sanford Medical Center on 4 South. That is one of the 3 COVID units. They have an ICU unit. They have 1 Northwest and 4 South. And so we came in and we were learning their protocols, policies, procedures for taking care of the COVID patients on those floors. And then we have been hands-on taking our own patients, and they all have COVID as a diagnosis.
We mentioned you're a nurse and you're on the front lines. Can you tell us a little bit about what you've seen patients go through during this pandemic?
Yes, sir. So I think it's important, and a lot of it is perspective for those that maybe haven't had a close call with COVID in their family to understand that this is very real and very serious. We see people, so when you're on room air, it's breathing like you and I are breathing right now as we're talking to each other. These patients, some of them have up to 60 liters of air. So normally, maybe when a patient goes in and they have some breathing issues, if it's a health issue that's not related to COVID, they might be on 2 to 3. So when you extrapolate up to 60 liters, and it's machines helping them to breathe, you can kind of begin to get an idea of the severity of what these patients are going through. We have neurological symptoms. We have coagulopathy issues, which means how your blood clots in the body. Some people, they are having clotting issues. We have people with the respiratory issues. It affects all systems of the body, and we really don't have a good definitive reason as to why.
Have you also dealt with military personnel who have contracted the virus?
Yes, sir. So I come from Eglin Air Force Base, which is in the Florida Panhandle. And when we were down there, that's what we're doing here. So we have experience from Florida. We're on a DoD installation taking care of dependents and active duty members that have dealt with COVID. And now we're bringing our knowledge up here with our brothers and sisters in North Dakota and their experiences to combine our efforts as a part of this whole of America effort to fight COVID.
As a captain and somebody who works in the medical field, you've seen the men and women of America's military, the best, the brightest, and the strongest, with this disease. What do you tell people who still don't take this seriously?
Yes, and I think that's an excellent question, sir. What I say, again, alluding to back at the beginning, is we need a perspective change as America. I think a lot of times we don't take things seriously until it hits home close to us. It's wonderful that the majority of people have minor symptoms, or there are a lot of people that are asymptomatic. But just because you or I might come away with mild symptoms does not mean that there are not people dying in hospitals from this disease. So if we, it's just taking care of your fellow man, which is what we do amazingly as Americans.
How often, and let me check in on you here, let me pretend like I'm your family here. How often are you tested for the virus while working in these hospitals?
So we were tested prior to arriving here to ensure our safety, that we're not going to bring in something during our travels. And so all of us tested negative before we started working our shifts. And we will be tested about weekly throughout to confirm that we're not picking anything up. The DoD's number one message to us and their priority is the health, safety, and well-being of the DoD members as we're deployed throughout these different regions to help support this whole of America effort in the fight against COVID.
You obviously have extensive experience. What kind of safeguards are in place to prevent the personnel who's up there who may contract it from spreading it? Is there any special training or special PPE courses you guys have gone through?
Yes, sir, absolutely. So we actually all had access. We brought some PPE with us. The hospitals are well stocked here. They have the gowns, the N95s, PAPRs, everything that we need to complete our mission safely and effectively. And then if anybody does become sick, they will be tested, they will be monitored, and we have quarantine procedures in place at all of the locations where we're stationed at and helping our brothers and sisters in North Dakota.
Captain Ron Golemboski, thank you for your service up there, and thank you for your time as well.
Yes, it was a pleasure, sir. Nice to meet you. Thank you.
Nice meeting you.